Hello, everyone. Thank you so much for joining on my YouTube channel. Again, it's a great opportunity to have you here. So, if you don't know me, my name is Ryan Samanyema. I'm a medical student studying radiography, my third year, based in Nigeria. And apart from my medical studies, in med school, I'm also a proficient, top-rated medical writers, on LinkedIn, globally. And I do a lot of writings on white paper writings. I do a lot of research-based writings, projects, and I also do things about medical blog content. I write about medical articles, depending on the type of medical content you want. So today I have an amazing medical student from the UK. Hey, Abigail, could you introduce yourself?
Yeah, so my name's Abby. I'm a med student from the UK, and I'm currently intercalating in the Master in Public Health, which has been really great so far.
Amazing. So tell us, what did you study during your undergraduate? What did you study?
Yeah, so I have done an undergraduate. I think maybe it's a slightly different system, but in the UK we kind of go straight into med school as soon as we finish school at like 18. So I've just kind of done my first 3 years of med school, and now I'm intercalating.
Okay, so how is the UK healthcare system right now? What do you have to say about that?
I think some parts of it are really great. I think that doing public health has kind of given me another lens to see it through. I think like every healthcare in this system in the world, I think there are a few issues that need addressing. And I think you see lots of headlines in newspapers which kind of talk about those. I think that COVID-19 has hit every single pandemic, every single country around the world, and it's had similarly a big impact on the UK healthcare system. But I do think, and I understand why, but it's such a excellent institution. It's like one of the like greatest things about the country. And I think it should be valued. It's such a great thing that we have access to. But like every healthcare system, it's got good things and it has things that might need a bit of improving as well.
Sure. I believe that the government is really doing great things over there in the healthcare system in the UK, and that's amazing. Thank you so much for explaining that first. So, I have a question for you. I noticed that you recently got a job right now, right?
Yeah, it's like Polygia. It's like a voluntary role. Yeah.
So what made you to apply for a voluntary and not a paid job? What made you to do that?
I think a lot of it is navigating these kind of opportunities as a student. I think that obviously you do have to kind of sacrifice your time to get to kind of build upon different roles. So for me, I started working with Polygia in my first year of med school. And I think it was just kind of a really tangible way to get involved in research. So I kind of went to med school knowing that I was really interested in global health. And it kind of just gave you that entrance in. And since then, I've really loved working with Polygia. And so it's been really quite fun to kind of step into a bigger role this year as co-head of policy. Um, yeah, so I think as students we're going to have to do things for free ultimately to get experiences that we can then build upon. So I don't mind doing it for voluntary because I really enjoy doing it. So it's really kind of a blessing to me as well.
Sure. Thank you so much for that. I love the fact that you stated about experience. Okay,
Mhm.
experience is really important in terms of everything we do. So tell us about that company. What does the company do?
Yeah, so it's kind of a student-led global health think tank. So it started in at Cambridge University, and since then they've had like lots of success in opening up different branches across the UK, and they actually have a branch in Nigeria as well. So it's kind of just giving students the ability to get involved in research. I think they're coming to med school. One of the biggest kind of barriers is how do I get into research? I think we all know that we're supposed to be doing research because it looks great on our CVs. It's part of being an evidence-based clinician. It's part of kind of expanding our horizons and learning how to interpret research into clinical practice. So I think we all know it's really important, but I do think it's quite hard to find opportunities and to navigate that world when you're not too sure why, like who to reach out to and how to get involved. So I think that's why Polygear is so great.
Absolutely. I love the fact that I love to check out that company, since they have a location here in Nigeria, and I'll definitely check out that company.
Yeah.
Um, as a public health student, medical student. Tell us, what is the meaning of public health?
Oh, it's so broad. I think it's, well, for me, I think it's everything that happens outside of kind of a hospital, but that also kind of gets brought into a hospital and into a primary care and secondary care settings. And it's like everything that kind of happens upstream is everything that happens around a patient's life. So um it's just so broad. I think it's quite hard to put a definition to it. It's the things um that determine our health. So it's, you've got the healthcare system, you've also got big commercial roles, you've got the social determinants of health, you've got economic determinants of health, you've got all these things that interplay. And these are the things that you don't really get to a good grasp of, like in a consultation. It's these broader things that all interact together to shape one's health. I think that's kind of how I describe it, if that's made sense.
Amazing. Um, what are the factors, of a public health practitioner? What are the importance in the healthcare system?
Well, I think the importance of it is just kind of seeing health from a different perspective. I mean, you're a med student as well. I think you know that you kind of sometimes, as I've kind of seen in my own experience on placement, I think we have very small consultation time when you don't really get to see a patient in their entirety. You kind of see this one symptom or this one condition that a patient's come in with. And so I think the pillar of public health is seeing a patient in terms of everything else going on in their lives and everything else going on around them. If that's kind of answered your question.
Absolutely, absolutely. I love the fact that, you said about public health being broad because my elder brother, who based in London right now, he's done with his master's. He studied public health during his undergraduate, sections, and from there he proceeded to travel to the UK to do his master's in public health, in global health, sorry, and yeah, so public health is really broad, and they're really doing a great job in terms of creating a healthcare awareness, amongst many, and that's amazing. So I want to know, you going through med school, and I was in touch with Olayemi, a final year medical student at Queen's University in London, and she shared about how she got funding, how she got scholarships, to go into med school. So how was it? How did you get the funding? How did you know, apply to the school? Did you get, initial, rejections of the medical school you applied for? So tell us, how did you get your funding, and how was your application process was?
Yeah, I think I'm so grateful that I think my application process was quite smooth sailing. So I finished school at 18. And in my final year of school, I was applying to medical schools. And so I applied for medical schools. And then I got invited to interviews at some, and I got offers for two of them. I also applied for, like, you have 5 slots when you apply to university. So I also applied for a biomedical degree, kind of as a backup choice. Yeah, and then so from then I went to do some interviews, and I was lucky enough to get offers to a few of them. And then I think we kind of come to medical school with kind of these rose tinted glasses on. I think we're like, oh, it's all going to work out fine, everything's going to go past really quickly. But I do think, like, finance is a massive barrier to medical school. It's a long degree, and you get funded like for the first 3-4 years, depending on what path into medical school you've taken. But I think I'm very lucky. Like, we've got the student loan company in England, so you take out a loan to do your studies, and then pay it back. But I think there's been quite a lot in like the news a bit recently that I've seen. But I think in the last 2 years of medical school, you're kind of left on your own in some ways. So it's a lot more dependent on you raising the funds to go alongside the bursary that you get, which is quite daunting. But I think it's going to be like picking up being aware of that early on, so that, like, I can work over during uni or over summer, especially to raise the funds for that at the end. Yeah, if that answers the question.
Amazing. What university are you going right now? Do your master's in?
London School of Hygiene and Tropical Medicine.
Wow, that school will be very expensive. Very very expensive. Really very expensive.
Yeah,
Are
as well.
there? Okay, continue. What do you want to say?
No, I was quite lucky. So I got funding for my master's, which was,
Yeah.
I don't really know how else it would have been possible to do my master's without it. So I'm very grateful for the scholarship fund, which is funding my studies right now. Because I think, again, we all have all these like massive interests. And obviously, as med students, as public health students, you will want to kind of benefit the world. But I think you're kind of looking for that one opportunity that's going to allow you to do that. And so I was very lucky to have funding secured for my master's this year.
Yeah, funding is really important, you know. So I want to ask a question. During your experience as a medical student, how do you, try to like balance the equation of using social media and also your medical studies? How are you balancing those equations?
Yeah, I think for me, I'm quite like a reserved person. The majority of the time, I find it quite, um, in some ways, I quite like keeping the two separate. But I think LinkedIn has become a really big tool for me over the past, um, well, since starting medical school, really. That's my top thing. Like, I think it's such a great networking, tool. I think it's definitely given me opportunities that I would never had otherwise. So I think LinkedIn is my like mainstream of like medical things, but also Instagram similarly. If you follow like a good few pages, you'll see lots of online events to go to, in-person events as well. So I went to a really good surgery conference a few months ago, and these are these opportunities that you won't be aware of unless you're looking for them on social media. So I think obviously I kind of like to keep my social media quite just like personal and just like a few friends on it. But at the same time, it's such a great networking tool. And in some ways, I don't really think I take full advantage of that because I like keep everything private and to my one side, but it is such an important networking tool. So LinkedIn is a great place. And obviously you're like doing like YouTube, LinkedIn, everything. So I'm sure you've got a bit of a different experience to me.
Absolutely, absolutely. So, I love that. I love that explanation you made. That was you hit the nail on the head. That is amazing. Thank you so much for explaining that to us. So, how do you, for instance, on Instagram or on LinkedIn or any other medical forums you're in or social media platform you're in, how do you create content that resonate with your audience or other healthcare providers out there, and also
Hmm.
in public health?
I guess I don't really make content. That would be like my first thing. I think in terms of, I think LinkedIn is quite a difficult platform to navigate in some ways because I think that there is a nice piece to not really sharing what you're doing and just kind of getting on with it. But also, I think, as I just said, I think you really know that in order to sometimes make these connections, you do need to be open about like your successes and like some things that haven't quite gone to plan because that authenticity is what is so valuable about it. Like I like going onto LinkedIn and seeing like my role models who have maybe had a few bumps in their road, but because they're so honest about it, it kind of resonates with you. But I think I'm just kind of learning how to navigate LinkedIn and using social media to my benefit at the moment. I think still it's quite hard to put yourself out there because whenever you do, there's so many benefits from it, but also it's a balance. Yeah.
It's really hard, it's really hard, but we just keep moving, So thank you so much for those explanations, Abigail. You've been a great speaker here. So how do you keep the latest advancements in public health?
Mm. I think going to university is a big part of it. I think that you show up to these amazing classes where, especially at SHTM, I've been so like grateful to have such great course mates and people from all across the world. And so I think you don't only see public health from like a British perspective here, but you see it all across the world and issues that you never were aware of are kind of brought into your attention, which is great. So going to classes and having these really in-depth discussions with people is a massive way to keep up to date. And I think that especially at uni, we kind of get sent like um, weekly news and bulletins, which are really good as well. And I think that it kind of comes naturally. If you're interested in a subject, you'll read a book, like you'll read further. So like you've got your recommended readings, but if you're interested in it, you'll carry on reading around the subject and you'll stay up to date with like for me, I just have the news app on my phone. But as soon as something public health comes up, I'll go and do a few more searches to kind of get a better idea of what's going on. So I think your interest guides you. And if you're interested in something, you'll keep up to date with it.
Sure, definitely, definitely. Your passion drives you, and that's amazing, Abigail. So, Whoa, that's an amazing explanation, Abigail. I believe that the audience will learn from this session. So how do you know, I'm a medical student, so I've been through some mental health degradations, and also I've been burned out someday. So how do you manage burnout as a medical student?
Or do I manage burnout as a medical student? I think it's a balance. I think sometimes I'm okay at managing it. Certain points of the year, at certain points of the year, I think it's really, well, not really easy, but easier to prioritize your mental health. So like when there's no deadlines coming up, of course, my mental health is like my top priority. But I think that kind of when exams start rolling around and when I'm like, oh, maybe I should have done that earlier, it's quite hard to take a step back and think what my priority is. And it should be my mental health all the time. But I think it's kind of quite hard to keep it the top priority all the time. But I think the best way I manage it is just the people that I surround myself with. So at uni, majority of the time I was surrounded by medics. I live with medics. And I'm just surrounded by such a great group of people who really motivated me and who themselves were quite intentional taking like a step back when the deadline started approaching. So I think it's having that group acceptance of like medical school is really important, but also your mental health is equally as important. And I think medical school being as long as it really is like a marathon and not a sprint, as lots of people say. And you're not going to get to the end of the marathon if you're sprinting the whole time. And so being able to take a step back and say sometimes for me it's I take Sundays off of working. Well, I try to. I'm not great at it, but having like that dedicated time where you're not going to do work is so important. And the majority of the time I can come back more recharged on a Monday because I've taken Sunday off. So it's kind of alleviating that pressure off yourself, having stricter boundaries to like not do work, which I think is quite hard around to medics sometimes. Um, and also hobbies. I've taken up running recently and I absolutely love that. And it's such a good way to detach, and having that in a schedule. It's like you have to give yourself this time to recover and to forget all the academia stuff and just do something that's good for you.
Amazing, amazing, amazing. I was having a great conversation with um Vapor. Vapor is also a medical student. She's um a a Canadian based in the UK. Uh, I'm sorry if I didn't pronounce it because I know she's gonna come across this video. I told her that you in med school, do you focus majorly on grades or the knowledge? I know grades are more important, in school and everything, but during working, I don't think grades are more important in what you offer to the table.
Mm.
Is what you know, your knowledge. So during your studying patterns, do you study to pass exams or do you study to gain the knowledge? Or do you just study just for studies?
I think it will again like depend on what it is. I think that so like at med school, a lot of our like um models are kind of broken down, and I think you've kind of got a different way of studying for each of them. So like the module that's kind of based on clinical conditions, I think that's kind of the main reason why most of us are at med school, to learn these conditions and how we best treat them and like learn the guidelines for treating them. And so within that, I think that's more of a, oh, I'll learn that just for knowledge. With the I think when I learn for knowledge, you're more likely to get a higher grade anyway. Kind of reading around things and actually having that good understanding is what's going to get you a higher grade. But sometimes with a few other modules that maybe I'm not as enthusiastic about, maybe that's kind of more I'm learning to pass that exam, and hopefully the higher grade and something else will compensate. I think that's kind of the approach I take. But also I think just realizing that actually getting the highest grade in your year does not mean you're going to be the best doctor, and does not mean you're like you could definitely be the best doctor with the highest grade. But I think it's med school is so much more than just learning a sheet of conditions. Like it's learning how to speak to people, learning how to look after yourself as well, as you kind of mentioned, because these are all the things that are going to make you like a long-standing, a happy, good communicator, and all these things are great as a doctor as well as just a grade at the end of the day.
Wow, amazing. I believe that the people that I'm connected with, you know them too, like the types of Jessica, Nibel, Ken, you know them, and also Kettingen. These are the finalists of a completed award that recently happened. Are you aware of it?
No, I'm not aware of it.
Oh, okay. So I want to ask you a question. What is your in public health?
Pardon. Sorry, didn't hear. I think my Wi-Fi is a bit funny.
Your specialization in public health. What's your specialization in public health?
I guess what's my specialization in public health?
Yeah,
Oh, I guess I didn't really have a specialization. So within like the way that my course is laid out, you can pick a stream. And so that could be like healthcare management, healthcare services. But I think that I'm very grateful for the position I'm in. I think being a med student and kind of knowing that I have to go back to med school after, there isn't like a career in mind when I graduate from my master in public health because I'm going back to medical school. And so that's enabled me to do like a general stream where I've got quite a lot of freedom over which modules I'm taking. But I went into public health with an interest in global health, but I just kind of knew that by doing public health, I think you get the really big diversity of learning about high income countries, low income countries, middle income countries, which I think is really interesting. You can compare the two, like all the differences, and see what they can learn from each other. So my public health training, like course, is very broad, which is quite nice. I think you kind of learn for learning rather than learning for a career or learning for that specific goal. So it's quite a nice time to intercalate now.
sure, definitely, definitely. Um, you know, you've been a great speaker thus far, and that's really amazing. That's really amazing. So, are there recently developed advanced technologies used in public health?
Um, I guess I can't pinpoint specific ones, but I can see how developing technology is going to enhance public health, if that makes sense. I think I'll put it around that way. Um, and also I think how they can have drawbacks in public health as well. I think we're entering this era of artificial intelligence, and although I'm not like a techie and although I'm not super well versed on it, I think you can definitely see um, how these things are really going to impact public health. I think in the UK, sometimes health records are a bit disjointed, and maybe development of these technical systems is going to really help enhance that and to make kind of one united data entity or like system. I think I was quite lucky over my summer to do an internship in which I was working in health data. I think that really opens my eyes. I think this whole year has really opened my eyes to kind of like the broadness of health and how all these things are hopefully will come together really well to help shape health. Um, and so I think data science is a massive thing. I think predicting trends. I think we've got an aging population in the UK, so predicting that and predicting the needs. I think it's all of these things that are going to be really important in getting ahead of the curve in a way. So being able to predict population demographics, because then you can plan on what you need to treat your population. I just think public health is all about drawing these other aspects of a person's life into the consulting room or treatment room or into the hospital. And I think that a lot of that can be bridged by better data infrastructure. So I think being able to join someone's like education, well, I think it's a balance, but being able to join all these different aspects together of someone's life to paint a better picture and lead to a more personalized way of treating someone that's more holistic and takes into account all the things that a person is outside of a condition or a symptom, and which is really important. So I think that all these things are going to come together to help get ahead of a curve, but also to make everybody's care as individualized as possible.
Absolutely. Thank you so much, Abigail, for today, for because I know you're a very busy person, you know, busy with work, busy with school and everything. And also, you know, having time to come up as a guest speaker for me, you know, on my channel, you know, to share expertises and delighting the audience more. So thank you so much for that. So in 3 minutes, what do you have to say about what are your last advice to the audience?
Oh, I've been reflecting on this like a little bit recently, but I just think that there's so much out there to do. Like if you are interested in something, just do it. I think obviously there are a few barriers that everyone has along the way. Like I had a few myself, and I think everyone will have them. But I think the main thing is if you're interested in something, let your interest guide you. I think that we have this ability to do so many things, and the opportunities are endless when you kind of carry on pursuing that one thing. And so I think even if something right now you don't see how it's going to get it's your end goal, but like with things like Pelagia starting out in first year, I knew I was interested in global health, but I think that having those experiences have really broadened my interest and gotten me into positions that I mightn't otherwise have. And then my second bit of advice would just be to not let other people's opinions shape your story. So even before I was coming to med school, a few people like told me, you know how competitive it is. Like, are you really sure you want to do this? And I just think that, you know, if you let someone else's opinion of you dictate like your narrative, that can be quite a dangerous thing, and it can really throw you off your purpose. So just if you know you're called to do something, if you know your purpose is in this specific area, just carry on doing it. I think if you apply to things and you carry on pursuing your dream, I think you'll get there one day. And you'll probably surprise yourself, because this time last year, I definitely couldn't imagine being where I am today. But I'm just so grateful for kind of God's grace putting me where I am today. Yeah.
Thank you so much for that advice. I believe that the audience will really grab something from it. If you love this, can do well to like, share, subscribe. You know, there's love in sharing. You know, who knows that this video could touch someone out there. So thank you so much for coming in, Abigail.
Thank you for
Thank you so
inviting me
much.
along.
You're welcome.